Stress test, exercise tolerance test, results. In the world of medicine, there are various tests and procedures used to assess our health and well-being. One such test, the stress test, also known as the exercise tolerance test, plays a crucial role in evaluating how well our heart functions during physical activity. What are stress tests, exercise tolerance tests? Stress tests, or exercise tolerance tests, are medical examinations that help doctors evaluate how your heart responds to physical exertion. The test involves monitoring your heart's activity while you engage in controlled exercise, such as walking on a treadmill or riding a stationary bike. The primary goal is to assess how your heart copes with increased demands for blood and oxygen during exercise. Why are stress tests, exercise tolerance tests, important? These tests are essential because they can uncover various heart-related issues that may not be apparent at rest. They help healthcare professionals. 1. Detect coronary artery disease, CAD. CAD is a condition in which the blood vessels supplying the heart become narrowed or blocked by plaque buildup. Stress tests can reveal reduced blood flow to the heart muscles during exercise, a telltale sign of CAD. 1. Evaluate heart function. Stress tests can assess how well your heart pumps blood, helping doctors identify conditions like heart valve disorders and heart muscle problems. 1. Determine exercise capacity. They provide insights into your physical fitness and can help tailor exercise recommendations for individuals with heart conditions. 1. Monitor treatment efficacy. For those with known heart conditions, stress tests can track the effectiveness of treatment and medication. Common stress tests, exercise tolerance tests. There are different types of stress tests, but two of the most common ones are: 1. Treadmill exercise stress test. During this test, you'll walk or run on a treadmill while your heart rate, blood pressure, and electrocardiogram, ECG or EKG, are continuously monitored. The treadmill's speed and incline gradually increase to raise the intensity of exercise. 1. Pharmacological stress test. In cases where you cannot exercise due to physical limitations, a medication may be administered to simulate the effects of exercise on your heart. This allows doctors to evaluate your heart's response without physical exertion. Interpreting stress test, exercise tolerance test, results. The results of a stress test are carefully analyzed by healthcare professionals. Here are some possible outcomes. 1. Normal. A normal result indicates that your heart functions well during exercise, and there are no significant signs of heart disease. 1. Abnormal. Abnormal results may suggest various issues, such as reduced blood flow to the heart, indicative of CAD. Irregular heart rhythms, or other heart-related problems. Further testing may be required for a definitive diagnosis. 1. Inconclusive. Sometimes, stress test results may not provide a clear answer. In such cases, additional testing or imaging studies like cardiac angiography may be recommended. How the test is conducted. A stress test typically involves the following steps. 1. Preparation. You will be asked to wear comfortable clothing and avoid eating or drinking for a few hours before the test. It's crucial to inform your healthcare provider about any medications you are taking. 1. Baseline measurements. Your resting heart rate, blood pressure, and ECG will be recorded before starting the exercise. 1. Exercise. Depending on your physical condition, you will either walk on a treadmill or receive medication to increase your heart rate. The goal is to gradually raise your heart rate to a target level. 1. Monitoring. Throughout the test, your vital signs and ECG will be continuously monitored by trained medical staff. You will be asked about any symptoms you experience, such as chest pain, shortness of breath, or fatigue. 1. Cool down. After the exercise portion, you will continue walking or pedaling slowly to cool down. Your heart rate and blood pressure will be monitored during this phase. 1. Post-test assessment. Once the test is complete, your healthcare provider will review the data collected and discuss the results with you. For whom and what diseases this test is for. Stress tests are typically recommended for individuals who fall into the following categories. 1. Symptoms of heart disease. If you experience symptoms like chest pain, angina, shortness of breath, or unexplained fatigue, your doctor may suggest a stress test to determine if they are related to heart issues. 1. Risk factors. People with risk factors for heart disease, such as a family history of heart problems, high blood pressure, high cholesterol, or diabetes, may undergo stress testing as a preventive measure. 1. Monitoring existing heart conditions. If you have a known heart condition or have undergone cardiac procedures, stress tests can help assess the status of your heart and the effectiveness of treatment. 1. Fitness assessment. Some individuals, particularly athletes or those planning to start a new exercise program, may undergo stress testing to establish a baseline of their cardiovascular fitness. In summary, stress tests, or exercise tolerance tests, are valuable tools in the field of cardiology. They help identify and manage heart-related issues, making them an essential part of cardiovascular care. If your healthcare provider recommends a stress test, don't hesitate to undergo the procedure, as it can provide valuable insights into your heart health and overall well-being. Always consult with your healthcare team for personalized guidance on your medical needs. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.